Hi, if you're getting an EEG test, these questions you can ask your physician so that you look very smart and be well prepared for this EEG test. Before getting the test, you want to ask these questions. Number one, what is the purpose of the EEG test? The information we get from the EEG test can guide many decisions we can make. You can make the diagnosis of epilepsy, it can guide the withdrawal of medications or how successful the treatment is, and it can record typical events to know if it is epileptic or not epileptic event. The second question is how long the EEG test will be. There are overall 3 variations of the EEG test in terms of length. The most common one will be a routine EEG, which will be anywhere between 30 and 60 minutes. And this is usually done in an office or in the hospital. And we can also use a little longer EEG, about 6 to 8 hours EEG, which usually is done outpatient, or we can do a more longer EEG between 24 hours to 72 hours, which is we call ambulatory EEG, when you can get the leads and go home. We should know that the longer the EEG, the more chances that we capture something abnormal. It's like you're looking at a street, the more you look, the more likely you will capture or catch these cars moving, and this same we capture the epileptic activity. The third question, should I be sleep deprived before the EEG test? We know that when we have the EEG test, if you sleep during the EEG, that will increase the likelihood of capturing any epileptic activity, because the epileptic activity become more active and easier to be seen during sleep. So sleep deprivation can be important. It's usually recommended to wake up early in the morning at 4 o'clock or 5 o'clock in the morning so that you can sleep during the test. But we don't recommend having like extreme sleep deprivation for 24 hours of no sleep, because that can trigger seizures, which we do not want. The next question, should I change my medications before getting an EEG? Medications do treat epilepsy and seizures and can calm down the electricity. So the effect of medication should be considered when we are doing EEG. We usually do not recommend stopping the medications or changing them just before the EEG, because that can trigger seizures, which also we don't want. The next question is, what are the risks of EEG? EEG usually is a very well tolerated non-invasive procedure, and we don't expect any complications. However, there are a few complications that can happen. Number one is discomfort and skin irritation when we're doing the test, and the other one can be a rare allergic reaction to the materials we use during the EEG test. Also, a considerable risk can be the false negative or false positive results, because the EEG is as good as the one who reads it. And this brings us to the set of questions after getting the EEG done. And the first question is that what are the results of the EEG and how that will impact my diagnosis and treatment. Your doctor will go over the EEG results one by one and explain them in depth so that you understand how these will affect your diagnosis and treatment. Another question you can ask, which is, who read my EEG and what are their qualifications? This question might be a little bit politically incorrect to ask, but it is important to know that the expertise of the one who reads the EEG matters a lot. And sometimes people who are not deeply trained or have fellowship training or long expertise in reading EEG might overcall things in the EEG. So it is important to know who read the EEGs and what are their qualifications. The next question, what type of epilepsy did my EEG show? There are 2 main types of epilepsy. The first one is focal epilepsy, and the EEG will show just focal spot or just one spot in the brain where the electricity comes from. And there is another one that is generalized epilepsy, and the EEG will show epileptic activity all over the brain. And it is very important to tell them apart because the treatment is completely different. The next question is that how will the results of the EEG explain my symptoms? Your doctor will be able to make a connection between the symptoms that you presented with and the results of the EEG to hopefully explain what are you having and why you're having them. Next, do the EEG results explain any triggers for my seizures? It is important to notice that during the EEG test, we do some provocative procedures like flashing lights and hyperventilation that can induce seizures, and we learned that these are some of the triggers that can induce seizures. The next question, do I need a follow-up EEG and how often? We usually do the EEG at the beginning of the diagnosis, and once the diagnosis is known, we usually don't repeat EEG unless there is an indication. We sometimes repeat EEGs, for example, to monitor the brain waves, and in kids, they have some issues with memory and their EEG is very active, and we give them treatment to see the treatment response. And we sometimes make decisions on weaning medications with EEG. So sometimes we can repeat the EEG, but not very often. It depends on the case. And to understand the whole results of your EEG in depth and what every result means, we have made a specific video about that. You can watch it next, and see you in the next video. Bye.